before we can get to know what gestational diabetes is, we have to know the background of type 1 diabetes and type 2 diabetes. Type 1 diabetes is usually a result in insulin deficiency because it's body's autoimmune destruction of the beta cells of the pancreas. And type 2 diabetes is strongly associated with obesity because it's usually caused by insulin resistance. So type 1 diabetes actually mostly happens in childhood, and type 2 diabetes happens in adulthood. So now that we know what diabetes is, let's move on to gestational diabetes. So basically, gestational diabetes is when you're diagnosed with diabetes while you're pregnant. Keyword, while you're pregnant. When I say keyword, it's because if you already had diabetes previously to when you were pregnant, then you will be called pre-gestational diabetic. So those are the big difference between the two, pre-gestational and gestational. Like I said, pre-gestational happens when you're already had diabetes and continue onto your pregnancy, while gestational diabetes is when you are diagnosed with diabetes while you're pregnant. I'm sorry, excuse my bad drawing. So, why do we care so much? Why is this such a big deal? Well, women with an uncontrolled diabetes and high fasting blood glucose levels in the last trimester have an increased risk of stillbirth. This happens because diabetes can affect the blood vessels that supply the placenta. Baby needs oxygen, and if baby's not getting oxygen, then that's not good. So basically, normal women in pregnancy respond to changes that are made by pregnancy by secreting extra insulin to maintain normal carbohydrate metabolism, while still providing plenty of glucose for the fetus. But if the woman cannot increase her insulin production, then she'll have periods of hyperglycemia, which is increased blood glucose levels, which is not good. And since the fetus continuously draws glucose from the mother, maternal hypoglycemia, which is low blood glucose, can occur between meals and during the night. Unlike diabetes itself, type 1, type 2, gestational diabetes can be controlled by diet and exercise alone. Sometimes the woman may require insulin injections, but if she has gestational diabetes, like I said, it can be controlled by diet and exercise alone, with good management skills.
Pregnancy affects a woman's metabolism whether or not she has diabetes mellitus. The pregnant woman's metabolism makes ample glucose for the growing fetus. So how does diabetes affect the mother? Spontaneous abortions, gestational hypertension, preterm labor because damage can be done to the placenta. During pregnancy, the placenta produces high levels of hormones that affect the action of insulin in your cells, raising your blood sugar. This raise in blood sugar can have an effect on the functioning of the placenta and the growth and development of the baby. Excessive amniotic fluid. Birth canal injuries can happen if blood glucose levels get too high. It can cause high blood glucose levels in your baby. The baby will produce more insulin just like you do. So this can cause the baby to grow larger than normal, which can cause bone fractures to the baby during delivery, severe bleeding to the mother during delivery, and birthing complications like shoulder dystocia. Shoulder dystocia is where the baby's shoulder is stuck in the pelvis once the head has been born. This can squash the umbilical cord, so emergency action is needed and the mother will need a cesarean done to deliver the baby quickly and safely. Untreated gestational diabetes can cause serious problems. If blood sugar levels remain elevated, too much glucose ends up in the baby's blood. The mother's higher blood sugar affects her baby because they get nutrients from her blood. The baby stores that extra sugar as fat, which can make them grow larger than normal, which can cause injuries during labor, like bone fractures. And the baby can also experience low blood sugar. Low blood sugar happens because the baby's body produces extra insulin in response to the mother's excess glucose. The baby can also have or be born with low mineral levels. Congenital abnormalities happen because gestational diabetes sometimes thickens a baby's heart muscle, causing the baby to breathe rapidly and not be able to get enough oxygen from the mother's blood. Jaundice is another complication that can happen after birth to the baby. Preterm labor is another complication that can affect the baby at birth. Preterm labor can cause many organs to be immature, like lung immaturity. Because of lung immaturity, the baby can also experience other complications such as respiratory distress syndrome. Because of gestational diabetes, the baby later in life is more likely to become obese and have diabetes.
If the patient does not have pre-existing diabetes, a prenatal screening test is done between 24 and 28 weeks gestation. For the prenatal screening test for gestational diabetes, the pregnant woman is usually ordered to fast before the test. This means that the woman cannot have anything to eat or drink for several hours before the test is done. The woman drinks 50 grams of an oral glucose solution, and a blood sample is taken 1 hour later and is analyzed for glucose. If the blood glucose level is between 130 and 140 milligrams, a more complex 3-hour blood glucose tolerance test is done. 2 abnormal 3-hour glucose tolerance tests are diagnostic for gestational diabetes. Calories should be evenly distributed during the day among 3 meals and 3 snacks to maintain adequate and stable blood glucose levels. Pregnant diabetic women are susceptible to hypoglycemia during the night because the fetus continues to use glucose while the mother sleeps. This is why the final bedtime snack should contain of 1 protein and 1 complex carbohydrate to provide more blood glucose stability throughout the night. Diabetic women should avoid single large meals with high amounts of simple carbohydrates. Oral hypoglycemic drugs are readily available to treat gestational diabetes mellitus. Glyburide, which does not cross the placenta, has been considered superior to metformin. Injectable insulin is the preferred drug to lower blood glucose levels during pregnancy. The HbA1c blood test is performed every 3 months to provide an indication of long-term glucose control. The fetus is at risk for organ damage resulting from hyperglycemia during the 2nd and 3rd trimesters because there is an increased tissue resistance to maternal insulin action.
Risk factors for developing gestational diabetes include a maternal obesity of greater than 198 pounds, a large infant at or greater than 9 pounds, or a maternal age of greater than 25 years. Also would include a history of gestational diabetes in a previous pregnancy, a family history of diabetes, or a fasting glucose of 126 or a post-meal glucose of more than 200. Labor is work and exercise that affects the amount of insulin and glucose needed for the mother. Medications given during labor with gestational diabetes. Some women receive an IV infusion of a dextrose solution plus regular insulin as needed. Blood glucose levels are assessed hourly, and the insulin dose is adjusted accordingly. Infant complications after birth may include respiratory distress and injury caused by macrosomia. The newborn is at risk for hypoglycemia because it leaves the high insulin environment that was in utero and enters a low insulin environment. Close monitoring of the newborn is required following birth. Gestational diabetes is common and resolves quickly after birth. Glucose usually returns to normal by 6 weeks. However, many women who develop gestational diabetes can develop overt type 2 diabetes later in life. Nursing care of the woman after birth usually involves providing emotional support as well as teaching them how to select appropriate foods for their prescribed diet. Encourage breastfeeding in women with gestational diabetes if it is not contraindicated with the newborn. Studies have shown that newborns who have been exclusively breastfed have a lower incidence of developing diabetes later in life. That concludes our video. I hope you all learned something. Thanks for watching.